Thank you, President. I rise to speak in support of the Health Services Amendment PPP Prohibition Bill 2025, Joe's Law. The bill seeks to stop the establishment of future public-private partnerships to construct acute hospitals or offer acute hospital services like emergency, surgical and inpatient services to public patients, similar to the current arrangement at the Northern Beaches Hospital. The Northern Beaches Hospital is run by the private company Healthscope and provides services to public patients under an agreement with the government as well as private patients. This bill comes, of course, in response to the unimaginable heartbreak of the loss of Joe Massa, who sadly passed away in September 2024 following a visit to the Northern Beaches Hospital, and the strong advocacy of Joe's parents, Eloise and Danny Massa. I want to give my sincere condolences to Eloise and Danny and commend their courage and bravery in speaking out and advocating for change that will benefit the people of New South Wales. In April, the government kick-started a task force to look into the public-private partnership with the Northern Beaches Hospital after Healthscope expressed an interest in passing the hospital into public hands. The Legislative Assembly Public Accounts Committee is also currently inquiring into the safety and quality of health services provided by Northern Beaches Hospital following a referral from the Minister for Health, Ryan Park. A roundtable to discuss strengthening the system where loved ones can raise the alarm over a concerning change in a patient's condition and a coronial inquest are just some of the measures underway in response to the tragedy. As Minister Park said in the other place, New South Wales has never supported the privatisation of local community hospitals. Where the public good and safety are at stake, we shouldn't risk transferring essential assets to the private market. Health, correctional centres and water, to name just a few. Labor believes these essential services must stay away from the private sector, which prioritises profit. There is, of course, a role for the private sector in health, but public-private partnerships are different. The staffing requirements and models of care are different under a public-private partnership compared to a public hospital. The Secretary of the HSU, Gerard Hayes, said it best when speaking on Healthscope recently going into receivership. The commercial need for an operator like Healthscope to run a business for a profit will always chafe against the needs of patients and hospital workers. And I want to acknowledge the HSU, who have long advocated against the Northern Beaches Public Hospital private partnership. This is true Labor reform, proving our promise to fight privatisation in more than one ways. And I want to also point out, Mr. President, it is unfortunate that it takes these tragedies to bring these sorts of legislation to the House. Members will remember we dealt with a tragedy which occurred back in 2016 in Bankstown Hospital, where the nitrous oxide and the oxygen were misinstalled and swapped, and we had the tragedy of a death of a baby and the permanent cognitive impairment for life of another child, Amelia Khan. And it took that tragedy for us to bring a bill to the House to make sure that the installation of medical gas was done in a qualified and licensed way, which it hadn't been hitherto. And I've got to say, without wanting to get political, because I know there's unanimity on this bill, but the Labor Party is often criticised for its penchant for public ownership and regulation. And I'm a strong believer in the market. I shouldn't sort of be misinterpreted on this sort of thing. Where the market provides genuine competition and good service delivery of goods and services, because of that free and open competition, it is a force for good, there's no doubt about it. But I was always taught in economics at uni, and it's turned out to be a very, very good grounding that this party backs in. If you have a public good the provision of a public good which the private sector will not necessarily maximise because it has a profit incentive, or when you have a monopoly situation not subject to competition, then the government needs to step in and run and own it. This is another such case whereby, as the Secretary of the HSU, Gerard Hayes, said, the conflict of the profit motive with the service delivery gets in the way of decent care, and in this case has resulted in a tragedy which should never have happened. So I want to just reiterate that I think as a party and a movement, our instincts are very good on this. You've seen the Minns Labor government in the short space of 2 years turning the tide and reversing the whole privatisation agenda. I think it's a good thing. It shouldn't go too far. It should be done surgically and where it's necessary. But in this case, it's entirely necessary, and I commend the bill to the House.